Today we're going to do your head, eyes, ears, nose, and throat assessment, okay?
Yep.
I'm going to start out by asking you all my questions and then I'll go into the actual physical assessment portion of it. Do you get any headaches?
Occasionally, not normal though.
Like how often?
Maybe once a week.
Are they triggered by anything that you know of?
No.
Can you tell me, are they usually in the same spot? Are they in different spots in your head?
Different.
Okay. Typically, where?
On the side here or in the front.
Okay.
Usually.
In the morning, at night, during the day?
Honestly, after a day's work, if I've been like in front of the computer for a couple more hours than I normally would be, but other than that, that's it.
So typically towards the end of the day is when you start to get them. Okay. Do you take anything to help with them? Any medications, anything?
Not usually.
No, ibuprofen, Tylenol, nothing?
If it gets bad enough, maybe ibuprofen, but usually not.
Okay. Have you ever had any head injuries, concussions, a blow to the head?
Back in my high school football days, maybe once or twice, but nothing that I ever got checked out for.
You never had a diagnosed concussion or anything?
No.
Okay. After any of those hits or anything, did you ever notice any dizziness, lightheadedness, nausea, vomiting?
Maybe lightheadedness, but nothing ever that too severe.
No, loss of memory, loss of consciousness, anything like that? Did you ever have any head or neck pain after those undiagnosed concussions or blows to the head?
No, not that I can remember.
Any discharge from your ears or anything?
No.
Do you ever have any neck pain?
No.
No. Any lumps or tenderness or anything in your neck?
Not that I've ever felt.
Okay. Full range of motion of your neck. You can move side to side, back, front, everything.
Yep.
Okay. Do you have any lumps or swelling anywhere in your neck?
No.
Any recent infections, throat, ears, nose, eyes?
No, not that I've noticed or something that's bugged me.
Okay. Any difficulty swallowing?
Nope.
Have you ever had surgery on your head or neck?
No.
Any vision difficulties?
Not that I've experienced yet in my life.
When was your last vision test?
I was a senior in high school.
Okay, and no changes since then? No blurriness?
No.
Double vision? Lights or halos, anything?
Nope.
Lights. Perfect. Any blind spots anywhere? Any floaters in your eyes?
Nope, not that I've experienced.
Do you have any eye pain?
Nope.
Any eye infections, pink eye, viral eye infections, anything like that?
I've had pink eye before, but
Recently?
no.
Okay.
It's been over a year.
Have you noticed any watery eyes or discharge from your eyes or anything?
Occasionally, like after a hard night's sleep or something, but that's normal.
Do you have allergies?
Yes.
Do they affect your eyes at all?
Yes.
In what way?
Puffy, itchy, watery.
Okay. Do you take any allergy medications?
If it's bad enough, I will in the morning before I go to work. But
24-hour Claritin?
yeah.
Okay. Do those help?
Yeah.
Okay.
Immensely.
Do you wear glasses or contacts?
I do not.
Never?
Nope.
Do you have any earaches?
No.
Have you noticed any hearing loss or hearing difficulties?
No. Through my work, we do audio testing. We get in a trailer, put a headset on, and then they'll play sounds for us, and based on high levels of pitch or low, we see what ear it is.
How often do you do those at work?
Once a year.
Are you exposed to loud noises at work?
Just occasionally, either out like on a dredge with our gravel pits or beside a paver or something like that, but it's once or twice a week maybe.
Do you
And
wear
it's not for very extended amounts of time.
Do you wear headphones or earplugs when you're out in the loud noises?
Earplugs, yeah.
Do you ever notice that you have to shout to somebody who's like more than a yard away from you when you're out in those loud noises?
Yeah. I mean, usually because they have ear protection, PPE in too, so sometimes you just have to yell a little louder.
Okay. Are you exposed to gunfire ever?
Yes, I'm a hunter.
Do you wear earplugs, headphones, anything when you hunt?
Earplugs.
All the time or sometimes?
Sometimes.
Okay. What would you say, like out of 10 times, how many times do you wear?
4.
Do you ever have any ringing or buzzing in your ears?
No. But ringing, maybe occasionally if the stereo's up too loud for a while, but buzzing, I've never even heard of that in years.
Do you clean your ears out regularly?
I actually used to use Q-tips and then was told by my now girlfriend that that's not good. So she does have a tool she bought that has a camera on it that can pick it out, which is, she says is a safer method. So I would say probably once every 2 weeks I do that.
Do you notice a lot of wax when you clean them out?
She tells me my ears are very waxy. What that means, I'm not sure, but yeah.
Have you had any recent colds or sinus infections?
No.
Okay. You said you had allergies. When you have allergies, do you notice stuffiness, congestion, runny nose?
Yeah, like on bad mornings, usually when I wake up and my allergies are bad, I'll notice my head feels a little heavier, which I think could just be part of the allergies too, but that's basically the only time.
Worse in the morning, then throughout the day it gets better?
Yeah.
Okay. Any triggers, environmental, outside?
Fur, cats. I think I have a dog and that doesn't seem to bug me, so it just kind of depends on the change of the year too.
When you're outside all day, do you notice they get worse when you get home?
If I'm outside all day in dust or working on something, I come home, they might be bad, but after a shower, they seem to clear up always.
Have you ever had any trauma or blows to your nose?
No.
Have you ever broken your nose or anything?
I have not.
Perfect. Do you get bloody noses?
Twice a year, maybe.
Are they just random?
Random.
You're not picking your nose?
No.
Do they bleed a lot or a little? Like a teaspoon of blood, or is it like pouring out of your nose?
No, teaspoon of blood. If it's bad enough, I'll shove a Kleenex up there for 10-15 minutes and it's fine then.
You don't do anything to make them stop?
No.
Just wait it out?
Yeah.
Do you have any sores in and around your mouth, in your throat, on your tongue?
The occasional canker sore, tongue or inside of your cheek, but other than that.
Not currently though?
No.
Okay, perfect. Do you have a sore throat at this moment?
I do not.
Do you get sore throats often?
Not really.
Okay. Would you say if you do, they're associated with like a cold, sinus infection?
Yeah, cold drainage. That would be the size of it, I would say.
Do you sleep with a humidifier in your room?
No.
Do you notice any teeth sensitivity with extreme hot or cold drinks or food?
Sometimes if I like ice cream or a really cold drink of water, it feels like it's just like shivering my teeth almost, but it lasts for 5-6 seconds and it's gone.
When was your last dental exam?
A little over 2 years ago.
Anything out of the ordinary at that, just a cleaning?
Yeah, just a cleaning.
Any cavities or anything that you've ever had?
One cavity.
Okay. Do you brush and floss regularly?
Brush more so than floss. I probably could be better about flossing.
How often would you say you floss?
Once a month.
Okay, now I'm just gonna feel your head and have you do a couple things for me, okay? Can you open your mouth for me? Close. Move your jaw side to side. Okay, now I'm gonna have you move your chin to your chest, and then back up and flex back. Perfect. Now I'm gonna have you try to touch your ear to your shoulder. Both sides. Now I'm gonna have you turn and look to each side. Any pain or anything while you're doing any of those?
No.
Any pain or tenderness while I'm touching anywhere?
No.
Okay. No. Tip your neck back a little bit. Not like a ton. Never had any issues with your thyroid or anything?
No.
Any pain with this?
No.
Can you swallow for me? Okay, now I'm just gonna ask you to read the smallest line on the chart that you can see.
LDCZOTEP.
Can you read the one below that?
PFCDTZL.
Now we're gonna close one eye and just read a few lines of that for me.
We played lots of games. She was the reigning Scrabble champion. I think her vocabulary was so amazing because of all the books she read. I taught her how to know to play spades, and she taught me how to play kings and corners. She spoon-fed me soup when I was too depressed to eat.
Okay, let's switch eyes now.
They're both weeping now. We would have been friends if we'd met outside. She was a good person. Melanie stands and throws herself on my bed. She hugs me tightly, shaking and sobbing. It's not me she's hugging, I know that. She's hugging the parts of Paige that she left in.
Now I'm gonna have you look straight ahead and close one eye. I'm gonna put my finger back here, and once you see my finger out in your peripheral vision, I want you to tell me when you can see it, okay? You can just say now when you see it.
No.
Perfect. Other eye, close this one. Same thing.
No.
Okay, now I'm gonna have you just follow my finger with your eyes, don't move your head or anything. Okay, now I'm gonna have you stare straight ahead and focus on something on the wall. And now just look at my finger. Perfect. And now back to the wall. Okay, now I'm just gonna feel around you. Tell me if you have any pain or tenderness while I'm doing this. You look up. Look down. Any tenderness or anything?
Mm-mm.
Okay. I'm just gonna take a look at your ears. Any pain or tenderness around your ears?
Mm-mm.
Perfect. I'm just gonna take a look inside of them here. Maybe tilt your head that way just a little bit. Perfect. Okay, now I'm going to stand behind you and I'm going to have you cover one of your ears and I'm going to whisper a set of letters and numbers to you and I just want you to repeat them to me.
I thought we already done this.
Yeah.
DP62. FL94 Rover.
Other side.
XLP1. EG42.
You stand up, just right here, just with your legs apart and your hands at your side. And then I just need you to close your eyes and just stand still for me. Okay, now you're just gonna lift one leg. Perfect, you can put that one down. And the other leg. Now I'm just gonna look at your nose. Can you close one nostril and breathe through the other one for me? Perfect, same on the other side. Okay. Any pain or swelling, tenderness in your nose anywhere? Runny nose, congestion, anything?
Nope.
Okay, I'm just gonna look at your nose here now. Tilt your head back a little further. Very hairy. Now I'm just gonna feel your sinuses. Any pain or tenderness? Still none?
Nope.
Okay, now I want you to chew, like bite down like you're chewing something. Open your mouth for me. Can you say ah?